So let's get right into things. Basically, I want to talk a little bit about how diabetes affects your feet. And what we see here is a callus you can see on the bottom. And that callus, it opened up and created this, which is a wound or a diabetic sore. The whole purpose of this talk is that you can live your whole life without developing one of those sores. Because the leading cause of amputation is having a diabetic wound or a diabetic sore. And my whole goal with this talk is to help avoid wounds, because wounds can help avoid amputations, which can happen with diabetes. The leading cause of amputations throughout the world is actually diabetes in those that have wounds. So everything we're going to be focusing on is how we can prevent one of these from happening, and then talk about some other things about diabetes. And also, during the course of this talk, if you'd like to ask a question, you can certainly type something in the bottom, or you can ask it at the end of the talk. I want to go through a couple of case studies of just one simple patient. And this is a patient you can see on the upper pictures here at the inside of the big toe, at the tip of the other toe. So you can see that there's two wounds that developed, and these developed, and you can see I debrided them right here on the bottom. But the whole issue with this is what we want to avoid. Does anyone have an idea what caused this? If you'd like, you can write a comment, or you can unmute yourself temporarily and let me know what you think. What do you think caused this? This was caused by a new pair of diabetic shoes with inserts. That's what this was caused. That's right. You got it right. Meg said it. It was tight-fitting shoes. But they were diabetic shoes, and they had special liners. But the issue is, just because you have diabetes and you get a proper shoe and a proper diabetic insole, it could create something like this, because this patient went to a different shoe provider, and that's one of the biggest challenges. Now, the other question, if you'd like to answer, because I appreciate when you guys answer, why do you think this happened? Did you think the patient felt this happening? Do you think this patient felt this in their shoe?
Probably not.
Probably not. And the answer is no. This patient didn't feel this. This patient noticed it a few days later and ran to the office. And the reason they didn't feel it is the word that starts with an N. It's called diabetic neuropathy. Okay? So let's go on here. Okay? Now, with diabetic neuropathy, it can cause a few things that can happen in your feet. Diabetic neuropathy can cause ulcers, but with diabetes, the first thing I want to talk to you about is about blood flow. Okay? So for blood flow, there is a large problem with people with diabetes and developing blood problems. So I want to talk to you guys a little bit about that first. In terms of blood flow, first of all, how do you know if you have bad blood flow? Do you know if you have bad blood flow? Is your blood flow good? Who determines that? You know, besides me, there's certain tests that we do for our patients, but blood flow is always a concern. And the way I kind of explain it is I kind of explain it about as the plumbing to your body. The blood flow is the life. You have to have enough blood, and if you don't, that can lead to problems. Specifically, if you have like wounds like we saw in the first picture, and you didn't have those treated and you didn't have enough blood flow, there's a couple of problems. One, you're probably not going to be able to heal the wound. And second, you're probably going to, if you're on an antibiotic, it's not going to get down to the wound. So blood flow is something that's very important for our diabetic patients. And what's happening with diabetics is that a normal artery doesn't have any clogging in the artery. But what happens is many times there's a buildup of a fatty substance in the walls of the artery. That's called atherosclerosis. And we want to evaluate your pulses, and that's where we put our hands on the top of your foot and on the back of the ankle, and we want to evaluate for good pulses. But one thing you have to know is those that have diabetes, a lot of times their pulses aren't a very good indicator of how the circulation is, because you could appear like you have really good pulses, but have poor blood flow. And the main reason for that is when you have the hardening of the arteries, it gives you a bad sense of what the actual circulation is. And so a better option is on this picture on the upper right-hand corner, is where you actually touch the tip of the toe. And if it's red and it gets white and then it gets red again, that's evaluating something called the capillary fill time. And that should be quite quick. So those are two main areas of evaluating the blood flow. You can do that on your own. Whoever you see as a foot doctor does it. And another thing that can affect swelling, blood flow, is the swelling. So the swelling, as we are sedentary, especially during this time of COVID now, I've been seeing people sitting down a lot more. Their feet are just ballooning up and they're swelling. They might get wounds because of that swelling. And the problem with the swelling isn't the blood getting down, it's the blood getting back to the heart. And this can cause a lot of different problems, such as wounds or such as draining. Because what happens when you have a lot of swelling, that drainage, that swelling wants to get out, and it uses the path of least resistance. That's why if you develop a sore, it's going to keep draining out of that area. Varicose veins can be an issue with patients. Usually varicose veins, in my practice, they're not really painful. I don't treat veins, but a lot of people with varicose veins, they use compression stockings. And compression stockings can help the blood flow to go back up to the heart. So it assists with that. And one thing, many of you in our office, you may have had circulation studies. And what circulation studies are, they're called, it's an ankle brachial index. Basically, it's this picture right here. Do you see how the blood pressure cuffs are on the thigh, and then, under on the leg, and then on the foot? And what you try to do is you try to compare the pressures between different areas. And if you find a big drop, let's say between the thigh and the leg, that can indicate that there's some type of a blockage around the knee region, which is the most common type of a blockage. And you would have to see a circulation doctor. And that's what we evaluate. We evaluate, well, where's the biggest drop? And if that drop is big enough, we refer you to a circulation or a vascular doctor. And these can change, just like any part of your health can change. And that's where it's recommended to repeat these once a year, and you compare, for example, 2019 to 2020, and see if there's any change in your circulation studies. So blood flow is a big issue for our patients. If nothing's wrong, it's not that big of an issue, right? But when you develop a wound, then that becomes a problem. Then that makes it hard for you to heal that wound. And one of the biggest problems that patients have is they have pain when they're walking. And this is something I didn't write the name down, but there's a name called claudication. And basically what that is, that's a symptom that happens, let's say when you walk a block or two and you just say, I have to sit down. And then you rest a little bit and then you start walking again, and you can walk for another block or two, then you have to sit down again. That's called claudication, and that's something very dangerous and sometimes can be missed by your doctor. And they might think it's back pain. You may think it's pain in your buttock area, but a lot of times that type of pain can be a sign of a circulatory problem. So if you're having any things like that, you should probably seek your doctor for an evaluation to see what's going on. Okay. And that's a good question. There's a question from someone watching asking, now, I have cold feet. Does cold feet have anything to do with blood flow or nerve damage? That's a really good question. I have many patients that have cold feet, and they have perfectly fine pulses. So cold feet isn't always indicative of poor blood flow. What's more indicative is when you feel the pulse, and if it's a good pulse, and if you do a circulation study, everything is normal, regardless of how cold the feet are not. I find patients that are a lot skinnier, they tend to try to keep the center of their body warm. And I find that their toes and their hands, they get colder, and that's more common. Another reason, as this person mentioned in the comment, is that sometimes you can mistake coldness for neuropathy as well. If they're feeling cold, that could be the neuropathy feeling. But more importantly, if you have neuropathy, you may not feel the cold, and that can be something that's very dangerous, and we'll get to that. If you have a lack of feeling, you can go out in the wintertime and not know that your toes are cold because they're numb because of the neuropathy, and that can cause frostbite and other issues. So that's a little introduction to blood flow. Now I want to go over a skin exam. And I think a skin exam is very important. Every time you see your primary care doctor, they should be looking at your feet. Don't let your doctor, if you have diabetes, leave your socks on. Okay, I think most doctors now, they ask their patients to take their socks off, but they need to take your socks off, that your diabetes doctor, your endocrinologist, and look at a few things. Let's start with the nails. You could look at the nails if there's some thickness in the nails like these, or if they have an ingrown toenail. Now, everyone asks me, does every ingrown toenail or does every fungal nail need to be treated? No, not everyone needs to be treated. Not every fungus needs to be treated. There are treatments for fungus, and we can talk about that's beyond the scope of this lecture. But fungus doesn't always need to be treated unless it causes damage to the nail, such as an ingrown toenail or such as another problem with the nail itself. Okay, ingrown toenails can be dangerous because they can cause infections. And once again, if you don't have the blood flow to heal that or bring the healing, it could cause a much worse problem. Next, you want to look at the calluses and corns. Everyone asks me the difference between a callus and a corn. Well, basically, the way I think about it is a callus is in the bottom of the foot, and the corn is on the top or on the sides of the toes, the top of the foot or sides of the toes. A corn and a callus, they're identical. I put a couple of pictures here on the bottom of a couple of types of calluses. Here's one on the bottom, and here's another one on the bottom. This one very commonly can be mistaken for a wart because it has that little central area in it, and someone might think it is a wart, but it's something called a porokeratoma. Basically, it's a clogged sweat gland that develops a callus in the middle. And here's another example of a callus. The problem with a callus is that normally a callus that's untreated or is on there too long without treatment, it can develop into this over here, which is an ulcer. That's why podiatrists, we trim down calluses, because calluses in a foot that maybe has neuropathy or poor blood flow could turn into an ulcer. And that's something that you need to be careful of. Not all calluses need to be trimmed down. If they're not bothering you, if they don't get too big, if they've never blistered underneath. But if you do a lot of walking or get a different shoe that's too tight or inappropriate, it could cause an ulcer. Another area that is commonly mistaken and missed is looking at dampness between the toes. So you can see this picture here between the toes of this patient, and there's this white discoloration. Now, this white discoloration, it might be an athlete's foot. It could be just dampness due to not drying out well enough. It could be a callus between the toes from the rubbing of the toes. There's a lot of things that can be problematic, but frequently, at least every couple of years, I see a patient because this little area of wet skin gets infected. And because of that, many times, let's say this infection happened right here, you may have to do a little incision and get that infection out and put these patients on antibiotics, and it can be a challenge. So the dampness can be an athlete's foot. Now, I think that if there's an athlete's foot or on the bottom of the foot, that should be treated with a cream because that can crack open the skin. And then finally, when you look at the feet, at the skin, you want to look and see if there's any ulcers. Ulcers aren't always painful because of what we talked about as neuropathy. So a neuropathic or patient that doesn't have feeling, they wouldn't feel an ulcer. And that's part of the reason that these ulcers take such a long time to heal. After this lecture, I'm going to give you a little link to a book that I put together about ulcers. So if you want to learn more about how to prevent them, how to heal them if you have them, they're very challenging because the majority of the patients that have ulcers, they're not painful because of the neuropathy. And so you just keep walking on it and it never gets better, or it takes a long time to get better. And it's very frustrating for everyone involved. So those are some topics about the skin. Now, if anyone has a question, you can certainly type it in the chat box. Any question about blood flow or questions about skin. And if not, I'll go on here to talk about the next topic. Next, I want to talk about the feeling exam. Now, For this lecture, I'm using real simple terms. There are technical terms, vascular exam, dermatological exam, or the sensatory exam, but I'm trying to use the simplest words to make it accessible to everyone. The feeling exam, I believe, is probably the most important thing that your primary care doctor or your endocrinologist is going to do for you. This feeling exam is something that's done periodically, if not at least once a year. And you push on different areas with this first device right here. It's called a Sims-Weinstein, or a 10-gram monofilament. See this little orange little piece of plastic? So if you've been to my office, we've probably done this. And we push on different areas on the bottom of the foot to evaluate your feeling. This is the amount of feeling that you need to have where if you step on something, you're going to know it. It's technically called, you have protective sensation, meaning if you step on a tack, you're going to know it. If you can't feel this, you could potentially step on a tack or anything. The most common things I see, and I had a patient actually this week, he has been back in, I'd say 4 or 5 times. And every time he comes in, he has glass in his foot, little pieces of glass. I think what happened is a bottle broke. He swept it up, but there was little shards of glass. And every time he comes in, there's a new piece of glass that I have to pull out, that it doesn't hurt because he doesn't have feeling. And that can be a problem. If you have problems with feeling, you are considered high risk. Okay, high risk for having an ulcer, high risk for having a problem. You're probably seeing your foot doctor every 3 months or so. If you have really poor blood flow or you can't feel your pulses, you're considered high risk. You're probably going to be seeing someone every 3 months. If you've had an ulcer, you're considered high risk. Those are the high risk categories within diabetic foot. We're also going to talk about vibration, the vibration sensation. When you think about sensation, I don't know if any of you have done this. Let's say you're hammering something and you hit your thumb with a hammer. And then what do? You either shake it or you put it under cold water and the pain kind of goes away. That's because in our body, we have different sensory tracts that in our spine that carry hot and cold, pain, sharp and dull, vibration. And some of these tracts of nerves are stronger than others. So the pain fibers aren't as strong, or the cold fibers or the movement fibers, they overpower the pain fibers. And so there's different levels. And that's why when we talk about feeling, maybe you can feel this Sims-Weinstein, but you can't feel this vibration. What I tend to find is people lose the vibratory sensation first, and then they lose the Sims-Weinstein. This sensation. That's why both of them need to be checked. And one thing, if you're getting this checked, please close your eyes, because patients, a lot of times they want to please the doctor. So they'll say, oh yeah, I feel it with their eyes open, and they're not really feeling it. And you have to realize that feeling is a gift. That's why I call it, they don't have the gift of pain. And one analogy I give to this, and we don't have this in the United States really anymore, is leprosy. Leprosy is a condition where people lose the sensation in their hands and their feet and different body parts, and they can lose their body part and not know it. And there have been many, many stories of people that have really bad infections and they lose parts due to their pets in the home, and it saves their lives and all these kind of gross things. But really, gift is a pain. A gift is it's a gift to have pain. And what I find with my patients, those that complain of painful neuropathy, it's actually good that you have pain, because pain is a better option than not having any feeling at all. Because what happens is, as it gets worse, you tend to have less pain. Now, all of my patients ask, well, doctor, what can I do to help my diabetes? What can I do to have less problems with neuropathy? What can I do for all of these things? And I am not an endocrinologist, but it makes sense that the lower your blood sugars are to normal, or the more you're able to get off your medications by either I think someone brought up that topic about kind of low carb eating or intermittent fasting or other things like that you may want to talk to your diabetes doctor about. The more you can get off the medications, the more you can help your neuropathy to get better, and maybe even reverse the neuropathy or reverse the diabetes. Those are possibilities. Once again, that's not my specialty, but it's something I'm passionate about helping patients with, or at least giving them some ideas to help them to be healthier. So that talks a little bit about the feeling exam or the neuropathy exam. Now, when we were doing this talk, some people asked some questions, and I wanted to spend a little bit more time talking about this problem called Charcot foot. There was a question about it, and one of the exams is called the musculoskeletal exam, but basically you look at the bones and the muscles, and I just simplify it and I call it the bone and pressure exam. What you want to look for is on the foot, are there any areas that are very prominent that have pressure that could create a wound? So to very clearly, you can see on these bottom two pictures, this toe that's curved is a hammer toe, and if that rubs on your shoe, that could create a sore or an ulcer. Also on the tip of it down here, it could create a sore or an ulcer because of the rubbing. Same thing with this bunion. If it rubs here or on the bottom, those could create sores. That's why it's important if you have a bunion or a hammer toe or another type of foot condition that doesn't allow you to wear a proper shoe, you may need to see a podorthist, or you may need to be seen by a fitter of diabetic shoes. There's some very good fitters both in Worcester and in Shrewsbury and around the area that we refer to. And usually, we'll talk about this in a little bit, but usually a diabetic shoe is a good option for most of my patients that have poor blood flow or a foot deformity like a bunion or a hammer toe or some other issue. And it's usually covered by insurances. But I want to spend a little bit more time talking about this condition called Charcot, because just this year, I've had 2 patients that have come in with Charcot. And I'd like to show you, here's a picture of a patient, not a patient, this is actually one of my patients that developed Charcot. You can see how all the bones are all like a big mass of bone here, and it's broken down. And basically what Charcot is, and I'll spend a little bit of time talking about this to you guys. Basically what Charcot is, it's a condition where you lose the feeling in your foot and you keep walking and you break your foot. And because of that broken foot, you don't feel it, so you keep walking and it breaks more and it collapses more and creates more and more problems. I find that Charcot, a lot of times it can be mistaken for having an infection because it gets red hot and swollen. A lot of times it can be mistaken for like even a bone infection if someone has a little bit of a wound there. The ones that I see, basically I've seen 2 this year. One was a patient that had diabetes and the other one with neuropathy, and another one that developed neuropathy due to alcoholism, because alcoholism is another cause of neuropathy. And they didn't feel their feet. They had a big red hot swollen foot. And I'm sad to say, but the treatment for that is to stay off your foot for about 6 months. And it's a challenge. You have to be in a big boot called a crow boot. It looks like almost like a clamshell type of a boot that you have to be in. And it takes all the pressure off the foot. And then once the temperature goes down, you know, these new temperature testing devices. So what I do is I have them check one foot and then check the other foot, and until they get to be the same temperature, because the temperature rises for such a long time. And what happens is there's a couple ways of thinking about. One is the temperature's so hot, the bones kind of melt and they break down. But this is the worst thing that you would ever imagine for people that have diabetes and that would develop the Charcot foot, and it's quite common. It's quite common. So if you ever develop a red hot swollen foot, you should see your doctor, okay? And think Charcot before you think anything else.
Dr. Pelto, I think we have
a couple of questions. Yeah, let me look here. So buying shoes online, good or bad idea? In terms of buying shoes, we're going to get to shoe selection in a little bit. If you don't have neuropathy, and if you don't have any foot deformity, you're probably okay buying a shoe online. If you have neuropathy, and if you have like a bunion or a hammer toe or some other thing, I recommend getting professionally fit. There's a lot of good shoe stores. If you want an athletic shoe store or just a regular shoe store, there's a lot of different places that you can go that can help you find a shoe. You're considered high risk. If you've ever had a wound or if you've ever had an ulcer or anything like that, you should be fit professionally for your shoes, or at least have a professional, your podiatrist or your doctor, look at the type of shoes that you're wearing. So there's a question here about orthotics in terms of helping foot pain. So in terms of orthotics, there's different ways of doing orthotics. Orthotics are inserts that go in the shoes. They're different types. The way I think about it, and I'm going to show you a picture here in a second about a diabetic shoe. A diabetic shoe insert is for someone that's not very active. Basically, they're not doing a lot of activity in this diabetic shoe. A custom orthotic, and that's what I think you asked about, a custom orthotic actually is better for someone that's more active and that's never had a wound before. And more of our patients are staying active longer and longer, so we're opting to do more of a custom orthotic than a diabetic, and I'll show you the difference between the two. Okay, so I'd be happy to answer that other question that you might have, and we can talk about that afterwards, that other question. So let's continue on here, talking a little bit more about these, but I really want to emphasize this Charcot is something that's bad, especially if you keep walking on it. If you stay off it though, your foot's going to kind of solidify like this. All the bones are kind of fused together, and then we'll be able to fit you into some type of a shoe. It might be a custom shoe, but at least you're going to be wearing a shoe. If you keep walking on it, your foot's going to continue to collapse, and it's going to get worse and worse. Also, when we talk about bone pressure, equinus or a tight heel cord is something we have to look into, because as we have diabetes for a longer period of time, that affects our muscles. It also affects some of our tendons, and there's a tightening of the tendon. And that tightness of the tendon can cause an increase of load in the front of the foot and can lead to ulcers. So a lot of times when you have an ulcer treated, you also need to loosen some of these other tendons. That's a typical procedure that's done in conjunction with that. And then those are good questions. If there's any other questions, keep them coming, okay? And then I want to kind of conclude here. We're going to go over some of the recommendations, because we basically covered everything about your foot. We didn't cover every single condition, but we had an intro about your foot. But the recommendations I have, and I want to show these to you. First of all, you should look at your feet every day. You should look at the tops, bottoms, between the toes. And if you can't look at your feet, you should get a mirror. You can use a mirror. You can use anything else to look at the bottom of your foot, or to make sure there's no problem. If you can't see, you should have someone else help you. I recommend circulation studies. And the way I recommend that is if you have diabetes and you're 50 or over, I recommend doing them once a year. Okay, if you're non-diabetic, even after 70 or older, because there's a lot of people that have circulatory issues and they're not known, and they can be a problem. Okay. So we can answer, I think some of these other questions we can answer directly afterwards. I see some questions. Diabetic shoes here. Let's talk about those a little bit. Now, everyone says to me, you know, Dr. Pelto, those diabetic shoes are super ugly. Okay, diabetic shoes aren't made to be real pretty. They're made to prevent any problems. Okay, and you can see here, a diabetic shoe is also an extra depth or a double depth shoe. So the extra depth allows this type of an insert to fit inside. And this is the difference. You can see this is a custom, this is a non-custom insole. It offers protection against any friction, but it doesn't really give you a ton of support like a custom orthotic. A custom orthotic tends to give a lot more support, okay? That's the difference. So if you do a lot of walking, if you're very active, you don't have neuropathy, probably a custom orthotic is better if you have foot pain. This is more for someone that needs a shoe that's going to protect them from causing any issues. Someone asks a question here. If someone has some of these issues, no feeling, swelling, deformity, history of falling, but no diabetes, should they see a podiatrist? You could see a podiatrist only because if your shoes are affecting you or causing you some balance issues, or if they have neuropathy, sometimes the no feeling of the neuropathy could put you at higher risk for other problems, and they have a deformity, probably seeing a podiatrist to make sure you're in a proper shoe. And then the question is about pre-diabetic. Is that a concern? I don't know of, it depends on how close you are to developing diabetes. So a pre-diabetic is someone that's almost a diabetic. They tend to be insulin resistant. A lot of times they don't get neuropathy symptoms. Sometimes they can get some beginning neuropathy symptoms, but really it's best if you can reverse that pre-diabetes. If that can be reversed, is a very good idea to work with your doctor on how to do that. Diabetic shoes, and then diabetic foot care. Some people prefer to see a podiatrist. Some go to the nail salons if they're reputable. Really, I don't have a preference. Some insurances cover diabetic care, some don't. But if you ever have a sore, a wound, or an issue, you should probably see a foot specialist about that. Okay. And I think really the most important thing for you is to have education and be an advocate for your own health. I don't think it really works. And I sometimes see this. I see, let's say, a husband and wife come in and this, let's say I'll pick on the wife tonight. Let's say the wife, says they have diabetes. My doctor just diagnosed me. And then they ask their husband about everything. Oh, what was my blood sugar? Or, I don't know what to do, or someone else is taking care of it. They just kind of abdicate their care to someone else. You really have to embrace your care as a diabetic and embrace the learning and education. And afterwards, I'm going to send you guys an email tomorrow if you registered for this. And it's going to have these two links. These are kind of little guides I put together. One's a healthcare guide to diabetes in your feet, and the other one's about healing your foot wound fast. So even if you've never had a wound, it's something good to look at. I also think if you go to a diabetes support group, and there's a good book. Someone asked me about the whole idea of the diet in reversing diabetes and weight loss and things like that are essential. This is a good book called The Diabetes Code. It's by Jason Fong. And he talks about ways of reversing the diabetes. So it's a $12 book. It might be something good to consider reading if you have diabetes. I'm going to show you these. I think these will show up here. If I click this, I think you guys can still see my screen here. What you'll see, it'll go to my blog here. And there's all these books that you can download pretty easily. And this is the one book on the healthcare guide to diabetes. And what I talk about here basically are 3 ways to prevent a foot wound, the steps in doing a comprehensive diabetic foot exam, foot care mistakes that diabetics can make, and questions to ask your podiatrist. So I think that's a good little guide. It's very simple. And then the other one here is about healing your foot wound fast, and you can just download it like that. And this has a lot more information about blood sugar, blood flow, the skin, very similar to what we talked about, bone and pressure evaluation, nerve and feeling evaluation. And it goes into a lot more depth about wounds and how to offload it and preventing problems and things like that. So these are some resources that I'm going to give to you guys if you'd like to learn more. Hey guys, thank you for watching Healthy Living. You're going to find a few links here I'd like you to click. One is to subscribe to this channel on YouTube. Also, you can learn more. There are some videos here you can see.